this morning. Good morning, everyone. My name is Deandra Coleman. I'm with the Virginia SBDC network. For those of you that are not familiar with our organization, the Virginia Small Business Development Center is a partnership program between the U.S. Small Business Administration, George Mason University, and local host institutions throughout Virginia. With 27 locations across the Commonwealth, we provide training and technical assistance to small businesses in their local communities. Our one-on-one consulting services are available at no charge. Today's webinar, Everything You Need to Know About COVID-19 Vaccines, Mask Mandates, and Virginia Workplace Safety, is presented by the Alexandria SBDC. We are recording today's presentation. You will all receive a copy of the recording and of the slides, and it will be posted on our website. Due to the large number of participants, everyone's microphone is muted, but if you have questions during the presentation, you can type those into the Q&A box. We do expect to have a lot of questions today, so if we're unable to get to your question, please email us after the presentation. We have also enabled the live transcript function, and you can adjust these settings via your controls at the bottom of your Zoom window. Before we get started with our presentation today, I'd like to introduce Rachel Stradling, Environmental Health Manager with the Alexandria Health Department. She has been directly engaged with the Alexandria business community throughout the pandemic, and it was her suggestion that we hold a program to clarify the issues around vaccinations and mask wearing. Rachel has agreed to join our Q&A in case there are any health-related questions, and we've invited her to say a few words here at the start. Thank you for joining us, Rachel.
So firstly, thank you so much to the Alexandria Small Business Development Center for hearing my plea for help. A number of businesses had contacted me for advice on masks and vaccines and can they mandate things. I don't have all of the answers. I'm just an environmental health manager. I usually run the food safety program. So I've been working with our business community for the last 18 months to find our way through this together as a community. So the amazing team in Alexandria came to my rescue, and thank you to the Virginia SBDC as well for hosting this and making it a statewide program. So thank you to them. That's all I really have to say. It's just really to express my gratitude for all of their help and support. So I'm going to hand it back to you.
All right, thanks so much, Rachel. We appreciate that. And now it is my pleasure to introduce our presenter for today's session. Douglas Taylor is a shareholder of Bean, Kinney, and Korman. For nearly 30 years, Doug has provided timely and practical legal advice and representation to businesses, business owners, and executives on a wide range of federal, state, and local employment and labor law matters. Doug regularly defends employment claims before the EEOC, DOL, NLRB, OSHA, and state and local administrative agencies in Virginia, Maryland, and the District of Columbia. Doug is outside general counsel to a private university in Virginia and advises colleges and universities on all aspects of higher education law. Doug is a member of the National Association of College and University Attorneys, and he is a board of directors member of the Arlington Chamber of Commerce. Please join me, everyone, in welcoming Douglas Taylor.
Thanks, Andrew. And thanks to everybody at the Alexandria SBDC for their efforts in putting on today's presentation. I'd also like to thank my colleague, Jennifer Schiffer, for all of her help in getting things set up for today. And last but not least, to Bean, Kinney Korman's marketing director, Chris Sutton, for putting together the materials for today on a tight time schedule. So I'm happy to have a chance to talk with you today about the COVID-19 vaccine mandates, masking, and workplace safety in Virginia. So a couple of months ago, there was probably not much of a need, if you would ask me, to have this kind of discussion. Infection rates for COVID were trending down, and we were thinking about some sort of new normal. But let's, if we can move forward, 2 slides, please. And one more. One back. Okay. Now we are on the upslope of the infection curve. And so it has many employers, both large and small, thinking about mandates for vaccines, what to do about masks in the workplace, and just in general, workplace safety. So we're going to talk briefly today about a number of rules that either control or should guide your decision making for your particular workforce. And then we're going to set aside some time to answer any questions that you might have. Just because of our time constraints, we're going to try to keep the questions to general interest. If you have anything specific to your business, then perhaps we can handle them offline through the SBDC. We'll be happy to talk with you about those. And before we get started, a few caveats for today's presentation. It's not lost on anybody that things are changing really rapidly on the regulatory front. So it pays you to stay informed of those changes. Not all of the laws, rules, and regulations we're going to discuss today may be applicable to you, your particular workforce. Could be based on your size or the kind of business that you do. State laws, for those of you who have workers outside of Virginia, state laws can vary and do need to be considered in terms of your decision making. And most importantly, your particular business setting, primarily how much risk of COVID you have in your particular workplace should really inform your decision making. So with that, let's get started with the next slide. Okay, so we are going to try today to look at a bunch of different part of the difficulty in for employers in dealing with these work issues is that you have so many things coming at you from so many different directions. From the CDC, we have guidance on COVID. Some of that is incorporated into the guidelines that we see from OSHA, also from the Virginia Department of Labor and Industry, and to a lesser degree, but there is some overlap. We'll talk about the guidance issued by the EEOC specific to COVID. The difficulty here is that there is not perfect consistency, I think it's fair to say, between these various resources, and there is some overlap. So it makes it a little bit difficult, when you're in business and you're looking at your workforce to try to figure out exactly what rules might apply to your particular work situation. Next slide, please. So the first area that we're going to talk about is the Occupational Safety and Health Administration. As many of you know, it's a federal agency. And the guiding principle here is that all employers have a duty to furnish a workplace that is free from recognized hazards that are likely to cause death or serious physical harm to employees. And unfortunately, as the last 18 months has shown us, COVID clearly falls into that category. So when you think about, what precautions you should take for your workplace, it really is based to a large measure on the level of risk you believe is inherent in your workplace. Previously, the OSHA guidance had used this sort of risk pyramid with very high risk workplaces, healthcare in particular at the top of the pyramid. And at the bottom of the pyramid, generally more applicable would be office settings where there is some risk, but the risk is relatively low. And the Virginia Department of Labor and Industry, and it's initially the emergency temporary standard, and then the final standard, sort of incorporated the OSHA risk pyramid in terms of the number of requirements and the level of safety that you had to exercise, really tied to the amount of risk in your workplace. For those of you in the healthcare services or healthcare support services, OSHA has recently come out with emergency temporary standard for those settings. It requires things like daily screenings for COVID, appropriate PPE, in some instances paid leave related to COVID infections. But aside from that, my basic reading of the new ETS for healthcare is that it incorporates most of the standards that we have seen in the Virginia state final rules, which are familiar to those of you who have a need to look at it, which is the level of precautions you have to take is tied to your level of risk. Next slide, please. So here's one of those areas that we were talking about where there is a little bit of uncertainty about sort of what regulations are really applicable at this point. And without going into the finer details of that, the Virginia Department of Labor and Industry, it's the Safety and it's the Virginia Safety and Health Codes Board, passed a set of regulations in final form that went into effect in January of 2021. And they were set to expire on June 30th, or when the Virginia's governor ended the emergency pandemic executive order. So at the end of that time, the board met and has proposed a set of amendments that are pending right now that it's fair to say would substantially rewrite the existing final standard for COVID workplace safety. And for those of you who are familiar with those, it basically deals with putting a reporting system in place to be sure that employees know how to tell you as the employer when they've been infected or when they have had close contact with someone who may be infected. You have some notice requirements to both landlord and to third parties, and in some instances to the Virginia Department of Health relating to COVID infections. There are some removal from work provisions for those who are infected or may be infected, and also some return to work requirements that must be met. So for the most part, that standard is going to be substantially changed. Our understanding is that the board has scheduled a meeting for today. For those of you who are interested, it's available online to discuss whether or to what extent the current proposed amendments will be put into place and sent to the governor for consideration. So stay tuned for more on that, because we don't know exactly at this point sort of exactly where we are in regard to those standards, but we should know more very soon. So let's talk about the CDC. The CDC is, as those of you know, a federal entity responsible for public health and science, and has throughout the pandemic put out lots of guidance. And this is guidance, by the way. These are not regulations and not law that you are bound by. But certainly, when I think about guidance for your decision-making perspective, from my way of thinking, it sets a floor for what you should be thinking about in terms of your compliance and what might create a safe workplace for you. Certainly, the CDC is one of those resources that you would look to see what the science says about COVID infections and COVID safety practices. So the big, if we can go back just one slide, please. So the big change, and it's a recent one, is that the CDC had previously said for workers who were fully vaccinated, for individuals who were fully vaccinated, there was no longer any need to wear a mask, that things could sort of get back to normal. But then at the end of July, that changed given the uptick in the infection rate in most parts of the country. And so now the CDC guidance is, even if you're fully vaccinated, you should wear a mask indoors, in public, or in areas of substantial or high transmission. Next slide, please. And why that's significant for us and for the majority of the country, it looks like all except Nebraska, for some reason, maybe it's just the heartland, you can see from the CDC data tracker that Virginia, along with most of the country, falls into the substantial and high transmission risk category. So following the CDC guidance, it would be that anytime you're in public, and that would be in most workplaces, the guidance would be that you should be wearing masks all the time. So this is a significant change. There has been some ups and downs in the executive branch in Richmond. I know that the governor is trying to do a great job of messaging, and I think for the most part, he's done a very good job on that front. Messaging on masks, the need for masks has probably not been, looking back on it, it's probably not been as clear as it could be. It was for a time, there's no need to wear masks, and now the position is that following the CDC guidance, most people should, even if you're vaccinated, wear masks. Not a requirement from the executive branch, but it is a should. Next slide, please. So the next area where it causes, there are a lot of regulations and some guidance that you will have to consider in this. Kind of goes to the question of whether and under what circumstances you could consider mandating COVID vaccines. And so the EOC has made it clear in its guidance that there isn't anything in federal law that would prevent you as the employer from implementing a vaccine mandate. There are a couple of caveats that if you're going to go that route, that you have to consider. One, if you have an employee or employees who require an accommodation due to a medical condition or disability under the Americans with Disabilities Act, or under Title VII, if you have someone who has a religious objection to vaccination, that you essentially have to engage in the ADA's interactive process to determine whether there are one or more, some combination of reasonable accommodations that would allow an unvaccinated employee to return to your workplace and not present an undue risk of harm, a direct threat of harm. So, so you've got that. So the answer to the big question is, can you mandate COVID vaccines? And the answer is you can. You have to keep those two caveats in mind. They're not, they're not small caveats, and there are lots of thinking that goes into the decision of whether to mandate vaccines, including that you would have to engage in, the ADA reasonable, that interactive process for reasonable accommodations. And for those of you who do HR, know that it can be a frustrating process. It's one that you have to go through. My takeaway on this entire issue is the one area where I see employers get into trouble with the courts on this issue is when they try to end the interactive process too quickly, or before you've actually gone through all lengths to be sure if you've concluded that there aren't any accommodations that you can reasonably provide to an employee who is requesting one in lieu of vaccination. Make sure that you've gotten to the end of that process and you haven't left any possible accommodations on the table. Courts seem to think that you as the employer have the obligation to just play that out to the very end of the string to be sure that there's nothing there. So ADA, we'll talk about both of these things a little bit more later on when we're addressing some questions that we have, sort of key questions, and you audience may have some questions as well. So at least under the ADA and Title VII, from the EEOC standpoint, vaccine mandates are acceptable. So next slide, please. So how is the ADA applicable to vaccine mandates? Well, it's a little bit complicated, but it goes something like this. In non-pandemic times, asking someone about their vaccination status would be a medical inquiry and would be covered by the ADA. You'd have to have reasonable business justifications for asking the question. But in the in the pandemic, for some period that the EEOC has yet to define, but still ongoing, the EEOC has said it's okay to have your employees provide you with, let's say, a certification that they've been vaccinated, that it's not a medical related inquiry, because asking someone about their vaccination status really doesn't tell you anything about their health. The EEOC's theory is, there could be lots of reasons, including many unrelated to health, why someone would not get vaccinated. And so it doesn't necessarily go to someone's health to have them provide you with their vaccine status, if you will. So that will change at some point. The EEOC has made it clear, and the rules will tighten a little bit more. But as it stands right now, there is nothing under the ADA that would make it impossible or require you to sort of engage in an individualized evaluation of each of your employees. It's enough that vaccines are related to workplace safety, and in the current pandemic, the EEOC is willing to, in a sense, kind of soften its approach to this part of the ADA. Next slide, please. So again, this may be familiar to many of you. The reasonable accommodation process, again, we've talked about that. And you have to go through the process, the interactive process, provide accommodations unless it would pose an undue hardship to you, the employer. That standard is a pretty high one. It's a high bar. It's designed to be. So, if you think it's a little bit inconvenient or it's a little bit costly, so forth, it has to be substantially so in order to meet the ADA's undue hardship standard. So again, the key here is if you have an employer or more than one who fall into that, they have a need for a medical accommodation, engage in that process in good faith and see if there are things that you can do for them that would, that would allow them to return to the workplace and not, and not pose a direct threat to themselves or others around them. Next slide, please. This Title VII of the Civil Rights Act of 1964 is what we're talking about, and it prohibits, along with discrimination on other bases, prohibits discrimination on the basis of religion, and that's what we're talking about here. It would be where an employee claims that they have a sincerely held religious belief that prevents them from being vaccinated. And so under Title VII, according to the EEOC, again, you have to engage in that interactive process with an employee claiming religious exemption to determine, again, whether there are reasonable accommodations that could be provided to the employee that would allow them to return to work without being a direct threat to themselves or a direct threat of harm, if you will. The interesting thing about the accommodation on the basis of sincerely held religious belief is that that religious belief has a very elastic meaning here. It's not that whether someone is a Baptist or a Catholic, it really is anything that would approximate the sort of belief equivalent of a mainstream religion. The EEOC has some really, I think, helpful materials on its website on this. It's worth considering. The EEOC's position is that unless you have some objective reason to doubt the sincerity of your employee's claim of a sincerely held religious belief, you should take their word for it, basically, because if you get into the slippery slope of questioning, to what degree someone's, either their belief is religious or it is sincerely held, it puts you in an untenable spot. Really difficult because those things are mostly subjective. So yeah, if you have someone who, you've got one of your employees who sent an email and you happen to see it saying, I really pulled one over on my employer, but that sincerely held religious belief thing, it's not really true. Well, that's an objective, reason to disbelieve that. But, short of that, it's difficult to rebut that. On this front, though, again, you have to provide reasonable accommodation unless it's an undue burden to you, the employer. But here, in the context of Title VII, the undue burden bar is much lower. It's really any more than de minimis or a nominal expense or inconvenience. So the bar is much lower, and you don't have to jump quite as high to satisfy the reasonable requirement standard, or to say, sorry, we can't accommodate you because there isn't anything reasonable that we can do. And one of the things that, before we move on to the next topic, one of the things I think is worth mentioning here is, just because your employee requests a particular accommodation, doesn't mean that you, the employer, have to provide that the accommodation requested and no other. Really, the key is that you provide an accommodation that is effective and allows in this case, the employee to return to the workplace without presenting a direct threat of harm. So that if there is an accommodation that is less expensive or less burdensome to you, the employer, and still provides the employee with that level of safety, you are perfectly within your legal right to substitute that accommodation for the one requested by the employee. Next slide, please. So, okay, so the takeaways here, I think we've already covered these. One thing I would say here is that the EEOC's position is that for the vast majority of employers, that vaccine mandates probably aren't needed. That it would be sufficient and probably preferred to strongly encourage your employees to get vaccinated, and that's been the EEOC's position. There are some potential downsides in terms of a mandate. One of them caught my attention. I do some work in the area of higher education. A lead story in one of the higher ed publications this week was that West Virginia University had imposed a vaccine mandate, and that there was substantial non-compliance. And with school getting ready to start, the question was, what do you do if you mandate something and you get non-compliance? What if you get compliance from your key people? What do you do with that? How do you impose discipline in that situation? At the end of things, if you have a mandate and there is not an ADA or Title VII reason for refusing to get vaccinated, at the end of the discussion, if you impose a date for vaccination and the employee does not meet that date, then you can terminate them. Or you could find an employee's, rather than go through with the vaccination, just leave. And so there are lots of sort of planning things to consider when you're making a mandate. A mandate is you're imposing a requirement. And so if you're going to enforce that, think about what it might mean if you do get either key people or substantial non-compliance. You could find that your business is somewhat disrupted. So you have to weigh that against your ability to maintain a safe workplace absent a vaccine mandate. Okay, next, please. So we're going to go on to the key questions. And the first one is, can an employer ask for proof of vaccination status? And if so, what would that proof look like? And so the short answer to the question is yes. Under the ADA, the EEOC says that, that requiring your employees to provide proof of vaccination is not a disability-related inquiry because it doesn't require disclosure of medical information. The distinction here is that if you are going to require proof of vaccination, it would be having your employees vaccinate with a third party, whether it's the CVS or the state or local health board, and provide you with a certification that that's been done. For those of you who have been in that setting and have been vaccinated, you know that there are questions that you are asked prior to getting the vaccine related to whether you have any medical reasons for not being vaccinated. So, for example, if you as an employer were doing COVID vaccines in-house or arranging with a third party, contracting with a third party to do that, the EEOC says, well, you've got access to those questions that are asked before the vaccine is given. And that does constitute medical related inquiry. So really, the prudent thing to do is have your employees get a vaccine from an independent third party and provide you with the certification that that's been done. It's the easiest way to do it. It's the least entangling way for you to do it. And then you'll know which of your workers have been vaccinated and not. So what kind of proof of COVID vaccination should employers require? This has been an issue that has come up for a number of clients recently. And I don't know that there's any one particular kind of certification that you should limit your form of proof to. The key is that it's a form of proof that you think is reasonably reliable. I know the CDC vaccination card that most of you are familiar with looks like it could be printed and forged fairly easily, and I'm sure that it is. But that is the generally accepted form of certification. So many of you who have the vaccine certification policy in place have relied on that form of proof. But there may be others, and I would be flexible in terms of the kind of proof of vaccination that you decide to accept from your employees, because there may be different ways of showing that. Unless you have some clear indications of forgery or just some reason that you have doubt about the validity of it, I would accept things like verification from a third-party provider, a doctor. We've seen a number of different forms of immunization records. It's helpful if it's on an official letterhead, but we've also seen some on this sort of electronic printouts that look slightly less official. Official documentation from a government health agency, even military immunization records. So there are lots of different ways to show that. And I think that really it is your level, what you need in order to, feel comfortable that the record that your employee is providing you is legitimate. So the next question is, what if an employee refuses to be vaccinated? Can employers terminate for that refusal? So we've talked about that a little bit here, but we'll go through it again. So if you have a vaccine mandate and you get to the end of things and you have an employee who just has not vaccinated, has not provided you with any proof of that, what do you do? Well, employees are responsible if they're going to request an accommodation, they're responsible for initiating that process. Typically, that's the general rule. So, if you have an employee who has not complied with your policy to provide you with proof of vaccination, but has not requested an accommodation, then the question is, at what point do you, do you say to the employee, well, look, here's the date, and we need your certification by that time. If we don't have it, then then your employment is going to end. That sounds harsh, but but it actually is acceptable thing to do. Large healthcare organization in Northern Virginia just recently gave that kind of mandate. It said, listen, we're coming up on a date. I don't remember what the date was, and if we haven't gotten your certification by that point, you are being taken off the payroll. So whether that would actually happen, we stay tuned for more. We don't know, but the fact of the matter is, it could happen that way. So again, the answer to that is yes, but it probably would be under limited circumstances. Next, must employers still require masks in the workplace? And this is one that I wish there was a black and white answer to give you here. We've got a bunch of different things competing, and I can tell you what I think we know, and there may be some things that we don't know. I think it would be a best business practice at this point to require masks in the workplace, even for your workforce that has been vaccinated and has provided you with certification of that. Again, the CDC has come out at the end of, I think it was at the end of July, with their updated guidance that even for fully vaccinated people, the recommendation is indoors that masks should be worn. So on the state side, there's a little bit of conflicting, I think it's fair to say. We read the Virginia final standard, the one that's still in place while its amendments are being considered. We think that the final standard does require masks to be worn in an indoor setting in workplaces. Although I have to say, if you look at the frequently asked questions that were put out by the Codes Board, it seems to imply that that's not true, that employers should follow the CDC's guidance. But again, at this point, the CDC's guidance is that in an indoor setting, masks should be worn even for vaccinated people in areas of substantial or high infection transmission. And so right now, as it stands, all of the areas in Northern Virginia and those in the greater Washington area are all in either the substantial or high categories. So I'll leave it to you to sort out whether masks are right for your particular workplace, and we may see some additional changes on that. But for what it is, it would be a best practice to require your workforce working indoors to wear masks at this point, given the kind of conflicting advice that we have at this point. Next question, please. So how may employers encourage vaccinations without requiring them? And that is a really good question. I think when I think about it from the standpoint of what you certainly can provide encouragement for your employees to be vaccinated and without violating the ADA. And what would you do in that regard? I think it's a campaign of awareness, raising awareness about the benefits of vaccination, making it clear that as an employer you encourage vaccination, for being flexible in terms of leave, to allow employees to be vaccinated. Also being flexible in leave, and on the other side of things, if the employees have experience any side effects of the vaccination, and just essentially, trying to address the concerns that that many people have about the vaccines, mostly health-related risks. I mean, there are lots of reasons why individuals don't get vaccinated, but it certainly, it certainly feels like it is the right thing to do at this point. As a law firm, we've gone to great lengths, and I know a lot of businesses have, to really sell the benefits of vaccinations, and to be sure that all of our workforce, knew how to get vaccinated, where to get vaccinated, what was entailed, and so forth. So I think that that is, that is, a key to it. Also, employers can provide for those employers who are mandating vaccines and doing it through third-party providers that are unrelated to the employer. You can provide incentives in that setting. The EEOC's theory is that there isn't the kind of coercion that they're worried about in terms of disclosure, involuntary disclosure of medical information. So there are incentives that you could provide to your employees. If it's the "I got vaccinated" T-shirt, whatever it is that you might like to do there, I think small incentives could work well. If for those situations where you're doing the vaccine in-house or through a contracted third party, your ability to provide incentives is a little bit more limited there. The EEOC, in its view, thinks that that situation is more coercive, that providing the information is not so voluntary, and therefore, your ability to give incentives is far more limited there, minimal, really. Next, can employers require unvaccinated employees get tested, and do employers have to pay for that? And how frequently can testing be mandated? So again, as to the question of can employers require unvaccinated employees to be tested, the answer is yes. According to the EEOC, there are a few caveats there. The test is supposed to be accurate, and it's supposed to be reasonably non-invasive. As far as how often to do it, I think it depends on your particular workplace situation in terms of the risk that you perceive. Certainly, there are a lot of businesses where testing on a once a week basis would not be unreasonable, it seems to me, and testing in that regard does not pose particular concerns for the EEOC. On the issue of can employers require employees to pay for COVID testing, this is kind of a complicated question. I don't know whether there's one right answer. My best answer would be probably not. In the case of, let's just say, where it's clear is in the case of an employee who is unvaccinated for medical reasons that that give rise to a disability. In that situation, the ADA, it could be viewed as a form of discrimination to require the employee to pay for testing in that situation. As far as paying for testing outside of that situation, typically the cost of testing is covered by health plans in the context of tests that are ordered when it's medically appropriate, whether you have an employee who is symptomatic or has been in close proximity to someone who is either known to be infected or is suspected to be infected. So in that situation, if the testing is ordered under those circumstances, the cost may be covered by health plans. But if you're just talking about routine testing, in lieu of vaccination. There was a lot of discussion about this issue, as employers rightfully do not want to be saddled with the cost of testing for employees who just are not sort of getting on board with the vaccine and are just willingly not being vaccinated. But I think that in the context of costs, the costs are not insubstantial. Even at this point, the costs are more readily, the tests are more readily available, but the costs are still fairly significant. So you may have difficulty maintaining your workforce in its current form if you're making your employees pay for that kind of testing. Costs alone may be prohibitive. So again, think about it in terms, practical terms. As a legal matter, you can require the testing. You may find that it would be something that you would want to pay for. Are you prepared to assume that cost? And if you decide to try to put that on the employees, you may find that you have significant workforce turnover, which can be both disruptive to your business and expensive as well. So we've got, let's see. The next question is on remote work. Remote work is a broad topic. Remote work has become common by all of the surveys I've seen. Many of you are still working remotely now. We as a law firm still are on a permissive basis. So I guess what I would say here is, if you're thinking about it outside of the context of remote work as a reasonable accommodation of a disability, let's set that aside for just a minute. Remote work as a reasonable accommodation can be an accommodation. Whether it's reasonable or not really depends on the kind of position that it is it's being considered. There are some jobs that simply cannot be done remotely, and if in-person attendance is required for a particular job, then I think it's easy enough to say that remote work is not a reasonable accommodation. But outside of that, there are a lot of office jobs where remote work is a possibility and has been going on for many businesses for the last, more than 12 months. So the Virginia final standard suggested that employers were required to provide telework while quarantining if it was feasible. Governor has made it clear that he thinks that remote work is something that employers should be doing. Again, here, it really depends on your particular workforce situation, and it depends on whether you're considering it in the context of an ADA or Title VII reasonable accommodation situation, or if you just have an employee who is worried, I just don't want to come back into the office. We hear this, I'm not vaccinated and I don't feel comfortable coming into the workplace, or even some workers who are vaccinated and still feel uncomfortable in close quarters of that work setting. That is a judgment call for you. You're weighing the inconvenience and potential cost of remote work to your particular business setting to potentially creating an impasse with an employee who is insisting on remote work. And we had a couple of other questions that came in that I want to address, because I think that if my practice is any indication, these questions are coming up fairly frequently, and they involve HIPAA. And one question is, what responsibilities for confidentiality in HIPAA must employers follow in collecting vaccine status and proof, and and the same for testing results? And related question, what are some of the strategies for keeping vaccine status confidential? So HIPAA, The basic takeaway here is that unless you are a healthcare business or a related business partner, for an employer replies to your requirement of COVID vaccination documentation to return to work with, you're violating my privacy rights by asking me that. HIPAA is very unlikely to provide a basis for that kind of claim. HIPAA's privacy restrictions simply are not applicable to you unless you are a healthcare business. There may be some state laws, if outside of Virginia, that could impact you. They're worth checking on. But again, HIPAA does not provide a basis outside of a healthcare setting for not providing vaccination status. The rule is, there was a decision recently by one of the federal courts, that said it makes sense when you think about it. It's like, as an employer, you can't force, your employee to be vaccinated or to give you proof of vaccination. But, likewise, the employee doesn't have the right to demand continuation of work, without that kind of proof. So they can't withhold that information and still, expect it to be employed. So the other thing that's interesting is that, and I fielded a number of these questions from clients, employees threatening to sue the employer for violation of HIPAA, but there's no private right of enforcement under HIPAA, according to the Fourth Circuit Court of Appeals. Enforcement is through HHS with the federal government, so that's kind of a hollow claim. For those of you in HR, you know that the ADA requires confidentiality of all medical information, and vaccine information is no different than that. Keep it separately, and and keep it in a safe way. For example, if you're keeping COVID vaccination status information on your workforce in a spreadsheet, you have to make sure that that information is ideally password protected or some measure of limited access there. As far as it's sort of a sub question here, a lot of my clients are asking, so to what extent can I share vaccination status with other of my employees in the workplace? That's a tricky question, and the EEOC considers the vaccination information confidential. So it is to be kept that way, and it's not to be shared unless there is a legitimate business reason for doing it. In other words, there's an employee who was unvaccinated, and there was a need to share that information with the employee's supervisor in order to be sure that reasonable accommodations were implemented. But that would be a legitimate business justification. But if it is just kind of sharing generally vaccine status of your workforce, that would not be permissible under the ADA. And so I think with that, those are all the questions that we had so far. If there are more that have come in, any that you have, I am happy to try to address those for you now, or get back to you on those.
Yeah, well, thank you so much. That was a very thorough presentation. Really appreciate it. We do have some questions here. So we'll start off. Would you be able to address, most of our attendees are small businesses, and how does the number of employee relate to the ADA and Title 7, and what are their requirements if they have fewer employees than that standard?
Yeah, that's a good question. So for the ADA and Title 7, it covers 15 or more employees, and Virginia state law is the same. There are some local laws that where the sort of the definition of employer is as low as 4 or more employees. So in those situations, and in many jurisdictions, the local laws are modeled after the ADA. So, so many small employers are going to be sort of in that same sort of ADA framework, even though they're smaller than the 15 employees. So what do you do if you're even smaller than that? You know, again, you're still back at the where we started out with this is, you know, is trying to figure out what to do in your particular work situation that is going to allow you to meet that OSHA general duty clause, which is to provide a workplace that is free from anything that's likely to cause substantial harm or death. And so when you're thinking about it, take a look at your workplace, take a look at what each individual job, you know, what the risk may be. And I would say take reasonable steps based on that to, you know, to mitigate the risk of COVID transmission.
Our business has different employee and volunteer classes, construction, retail, and office. Do vaccination and mask policies need to be uniform for each group?
Well, that's a really good question. And it, I'll say it this way. If you're thinking about like imposing a vaccination mandate on like one employee or like one small group of employees, there can be some risk in that you somehow are targeting that group of employees for treatment that you're not imposing on other groups of employees. And then you get into things like whether there are demographic reasons that you know, would cause some you know, legal risk in doing that. So typically, you know, if you're going to impose a mandate, you would sort of be thinking about grouping like employees, you know, job duties, or you know, in the case of COVID, you know, the risk attendant to particular jobs, and sort of grouping those together. So if you're going to think about your workforce in different ways, make sure that you have taken a look at, you've got a legitimate business reason for identifying the groups differently.
If an unvaccinated employee is teleworking, can you require weekly testing?
No, I don't. I'm not. Well, I guess I might turn the question around this way. I'm not sure why you would want to do that. But so, you know, I think in that situation, you would want to consider, you know, what your reason is for doing that, and why it would be, whether there is a business need for doing it. Because again, you get into a situation where you want to have a legitimate business reason for what you're doing to one employee as opposed to others, because if you're making it harder for one employee or one small group of employees, there's always some risk that they're going to say, hey, you're targeting us for some kind of treatment that we don't think is fair, and we don't think there's a reason for it. So think about why you're doing it and be sure that you're comfortable with your answer to that question.
I think all I would add to it, and I don't know if you mentioned testing in the presentation, but you know, are there situations where they could require testing of those who are unvaccinated and they're in the office, but not of those who are vaccinated, or would they have to do it across the board?
No, I think that again, you know, we'd have to think that one through. But I think that presents a different situation, because really, the situation that you described is really related to the level of risk that I mean, look, as an employer, you're in a position to know what the risk is. So take a look at your workforce. Those of you who, you know, most of you have done it under the final standard from the Department of Labor, done your workforce survey and determine your level of risk and so forth. That's really what you're looking at in terms of whether you could differentiate between groups of employees.
If an employee is known to have COVID, to what extent is the employer liable to disclose to other employees who use the same area or office space?
The general rule there is that you can disclose the fact of the exposure, the fact of the infection, but not the employee's name. You know, typically what you would do in this situation, you can't do it without the the infected employee's permission. You have to have their authorization to do it. So typically what you would do, a best practice would be, if you had an employee who was infected, you might want to consider asking the employee for authorization to, let other people know. Depending on your workplace, I think most coworkers know anyway these things. I mean, I find that there are very few secrets in the workplace, but as far as without authorization disclosing the name of an infected employee, that you should not do.
We had a couple of people ask about volunteers specifically. Is there any different treatment with masking, vaccines, all of that for those who are volunteers versus those who are in a work relationship?
So for volunteers, typically the workplace rules that we've talked about would not be applicable. The ADA, the Title VII, and so forth, because they cover the employer-employee relationship. Volunteers fall into a different category than that. So what do you do in that situation? This is, I do a lot of work with nonprofits who, utilize a lot of volunteers. And the concern is this: we're obviously concerned about the level of risk. We want to try to, in a good sense, in a positive sense, we want to try to keep everyone safe, including our volunteers. We don't want anybody getting ill, but it might happen. And so what do you do in that situation? We've had some organizations that have, as a condition of volunteering, have utilized a COVID waiver of liability, which at least Virginia law on that area is a little bit is a little bit more difficult than most states. But so you could consider, if you thought there was significant risk and thought it was a prudent business decision, you could require volunteers to execute a waiver, releasing you from assuming the risk of COVID, basically, under Virginia law. The downside to that, though, in any volunteer setting, is that you may find that you have fewer volunteers. In other words, you can have people come in and just continue doing what they do, volunteering, or if you want to try to get a waiver from them, you may have, people saying, no, thanks, I'm not interested. So it may vary depending on your particular situation, but there's kind of some practicalities involved in there, along with some liability concerns.
Can we legitimately require masks for all customers to enter into the store as they did when there was an official mandate? Now that there is no mandate, can they still require of their store for the customers?
Yeah, that's a little bit of a tricky question. I think it depends on the business itself. There are some concerns in a situation where, let's see, for mask mandates, I tend to think that you can, in most situations, you may have someone who says, I can't wear a mask, in which case there are some concerns, some ADA concerns, but it would depend on the situation as to how significant they were. That's kind of a technical question. I think I could probably answer that one a little bit better with a slightly deeper dive on that one.
Yep, and whoever, I'm sorry, I took your question out of my list here, but if you would like to email us, you definitely can. We can investigate further if we need to. How liable is the employer with an employee who refuses to get vaccinated and the employee wants to work from home versus following the guidelines to be vaccinated by the employer?
I think it gets down to, in part, and this is a good time, if you haven't sat down with your remote work policy in a while or haven't really thought about this, I always think about the divide this way: whether you have whether your policy has remote work as a right, in other words, your employees have the right to work remotely, or whether it's a privilege to work remotely. For the most part, the best business practice is to maintain control of your employees' ability to work remotely, so that, you know, I mean, for obvious reasons, remote work is not for everyone, and it doesn't always work out. So you want to be able to pull back on that in the event that you, the employer, decide it's not working. So in a situation where it is, you know, it is not right, but it's a privilege. In that situation, you know, you're weighing a lot of things, again, practical and legal. Unless remote work is an accommodation of the kind we discussed earlier, there wouldn't necessarily be, you wouldn't necessarily have to continue remote work if there was some reason for not doing it that way. A lot of things that go into that question, but I think the answer is you could pull back on remote work in that situation unless it was, you know, either a medical or religious accommodation.
Can an employer refuse to pay leave for people who get sick from COVID? I'm assuming from COVID, but who are not vaccinated?
I'd have to think about that one. I don't know the answer to that. You know, my gut is no in many circumstances, but that's one I'd like to kind of mull over.
Okay. If the employer mandates the vaccine and an employee suffers an adverse direct reaction directly related to the vaccine, is the employer held liable to cover any costs related to the employee's injury or sickness under workman's comp?
Under workman's comp, the answer is, I think the answer in Virginia is no. I don't do a great deal of work in the area of workers' comp, but I think that's the right area. And I think general liability in that setting is fairly low. There are some limits in terms of the scope of liability.
I only have one employee that isn't vaccinated. Am I able to mandate that she gets vaccinated?
This has been the question of the moment. It feels like for me, I've probably fielded this question 8 times in the last week. And so it goes something, you know, like this again. You've got this sort of one employee situation again. So and you haven't mandated, right? You haven't mandated the vaccine. So you in order to get full compliance, you would really have to say, okay, look, I'm going to have to require you to do it. And then you sort of get the situation where you are you doing anything to target one one particular employee? Is there a legitimate business reason for, has something changed that would would now sort of require or mandate a vaccine as opposed to before? One of the things that that we're considering, the client, it's something that could be considered is what about for newly hired employees when you haven't had a vaccine mandate? We haven't had a vaccine mandate to this point, but we anticipate that we're going to be doing some hiring. Can we require all new employees to get vaccinated? And I think the answer, as long as it's handled carefully, is I think it can be done. But again, that's a little bit of a tricky spot to be in, and it's one of those areas that requires some careful consideration, some planning.
If a vaccinated or unvaccinated employee has symptoms similar to COVID, can you require a negative COVID test before they return to work? And if yes, does the employer have obligation to cover lost wages due to staying out until the results are in?
Of the first part, the answer is yes. This is one of those areas where there now is there's some different guidances from the CDC and then at the state level, but I think you can require negative test as a condition of return. CDC has guidance on that, and it goes something like testing 3 to 5 days after, after first indications of infection, wearing a mask indoors for 14 days or until you get a negative test result. That's different than, I think, what the Virginia standard is, but in any event, Virginia standard is in flux and may be different, a week from now.
Could you address quarantining requirements? For example, as children go back to school and may get COVID, what are specific requirements for mom and dad to quarantine as well? And how would that affect the small business, the employer?
It depends. As a law firm, our policy is that we have sort of permissive vaccination, and we require reporting for close contact with someone who is known or suspected to be infected with COVID. And in that situation, then you would have to sort of go through the sort of protocol in order to return to work. And it would either be a certain number of days, I think it's 10 days out of the office, or a negative testing. So, again, I think it depends on the circumstances. And in that situation, it would probably depend on the employer's policy.
Would it be discriminatory to deny a candidate for hiring based on vaccination status?
Vaccinations, yeah. That's a really good question. I don't think we know the answer to that specifically, but it gets, I've seen the suggestion of handling it this way, of sort of, we require for this job that the candidate be fully vaccinated, as a condition, just to sort of letting it be known to applicants for the job that that is one of the requirements of the job. But that one is, I think it would depend, because again, you've got an obligation in that situation to provide reasonable accommodations. So it would be, it's a requirement of the job, but we also provide, reasonable accommodations as needed.
We have a few more. Let's see. Sorry, I'm just scrolling through here. We have lots of questions, guys. I'm glad we're getting through a good amount of these. We'll ask a couple more. Would you be able to go over reasonable accommodations that employers have to provide for employees that refuse to get vaccinated?
Yeah, again, it depends on, completely depends on the situation. What's reasonable is, I guess, depends on the facts and circumstances. So reasonable accommodations can be anything from changed work location to additional PPE to changed work shift. One client was able to, for an unvaccinated individual, change the work shift to sort of an overnight setting, which was okay with the employee, and sort of limited, reduce the risk to a reasonable level in that particular situation. But really what you're trying to do is think about how many, asking the employee, what accommodation is it that you think you need? The obligations are, to provide something that reasonably allows the employee to be in the workplace unvaccinated, without being a direct threat, which sort of means a significant risk of harm to themselves or others around them. So it is really fact dependent. I would just emphasize again that even if at the end of the interactive process you decide a reasonable accommodation is just not possible, play that process out, because you want to be able to say, if it ever becomes contested, that you went to a full length to try to reach an accommodation with the employee.
And I don't know if you had mentioned this in the presentation or during the Q&A, but how do you store vaccination status? How do you store it safely if you're an employer?
I think it depends on your particular workplace and your essentially your technology and capabilities. I think it would vary by workplace. What I would say is that you should store them separately from your regular HR records and store them under some setting, whether it's a physical setting or a digital setting that has very limited access and it can only be accessed on an as-needed basis.
Are businesses required to contact trace?
No.
That was an easy one. Yeah. Does the employer have to continue to pay when an employee is absent for COVID-related disease or exposure?
Yeah, that one I would have to answer offline because it would depend on a lot of circumstances that I wouldn't be able to answer without that.
Okay. I think the only thing I wanted to mention, Terry did send in, she said, or I'm sorry, Virginia Immunization Information System has a way to ask for record of COVID vaccination, and they sent a link. I don't know if you're familiar with that at all.
I don't know. I don't know about that link. I guess what I would say is there are a lot of ways that you could, that you could get confirmation of vaccination status, and I've seen a lot of different ones. Some of them seem better than others. I think you're sort of looking at the situation. You could require only one kind, but I think what you're going to run into there is if you have employees who are getting vaccinated by third parties, you're going to find a variety of records. Most people are familiar with the CDC card, but there is at least a school of thought that they're pretty easy to fake, and so you're trying to, ideally, the reason for the certification is so that and who is vaccinated and sort of what level of risk you have in your workplace.
All right, well, we asked a ton of questions today, guys. We got through a good amount of questions. We had a lot come in today. So as we had mentioned before, feel free to email us. The email is help@virginiasbdc.org. Doug, thank you again for this. We really appreciate it. Thanks to Alexandria SBDC. We appreciate you spending time with us and answering all of our questions and going through such a detailed, and it can be pretty controversial. So I appreciate you spending so much of the time with us and getting to the bottom of things.
Thank you so much.
We will send an email to a link with the recording to everyone here, an evaluation, and to the slides. So you didn't have to write furiously. You will get the recording and the slides. And if you would like to sign up for upcoming webinars or access recorded webinars, you can go to virginiasbdc.org/training. You can also access on our website the COVID Business Recovery Center, which we developed to help owners not only continue business operations, but to thrive and recover. These resources are designed to be used in collaboration with your local SBDC advisors. And you can sign up for a free and confidential session. So email us help@virginiasbdc.org, or you can sign up at our website. We have a lot of resources for small businesses, answer your questions, and we have different resources from A to Z for your small business. So be sure to take advantage of that. Thank you everyone for attending. Thanks again, Doug, and we hope to see everyone at the next session.